Walker, the CEO of Ambulance Victoria, Christine Kilpatrick, the CEO of the Royal Melbourne Hospital, and we've also been joined by Karen Foolan, who is a nurse unit manager in the surgical ward teams at the Royal Melbourne Hospital, and we've been also joined by our representative group of the most recent paramedic graduate class here at Ambulance Victoria. I want to go through quickly some of the COVID numbers of the day. I wanted to then talk about a significant investment across the range of public health and Ambulance Victoria areas associated with the COVID response. I then wanted to talk about changes in elective surgery and then touch on just a few other issues before asking Karen, Tony and Christine to say a few words. So in terms of the daily numbers, the headline figures for the day are very much the continuation of what we've seen over recent days. First, in regards to 5 to 11-year-old vaccination rates, that is now at 47.4% in a just over 3 weeks effort. That is a very solid number, but of course there continues to be more we can do in that space, and we are. The third dose rate has increased to 42.7%. The total number of appointments out there in our state-run system is over 107,000 appointments out there. There is plenty of opportunities in either the state-run system, the pharmacies or our GP networks to come forward and get those vaccinations, be they the 5 to 11-year-old initial vaccines, now the 16 and 17-year-old third dose booster arrangements as of yesterday, and of course 18 and above. The importance of getting that third dose is so critical to allowing us to safely stay open and continue our journey on recovery from this Omicron wave. Tragically, we have to report 36 deaths in the last reporting period of people in their 60s, 70s, 80s and 90s. Of those reported deaths, 10 were reported as occurring in the past 2 days, some 18 over the past fortnight, and in regards to the reconciliation of some other records that have now been settled, a further 8 cases date back to November, December and early January. In regards to the package that we're announcing of new funding right across the board of our health system, we're doing so because our health system continues to be the subject of unprecedented levels of demand from this Omicron wave, now into, well and truly, into our second year of this global pandemic. And this investment is so critical in allowing our world-class health system to continue its work of getting through this crisis and supporting our people, our infrastructure and our services to make sure that the journey we are on is the one that we stay successfully on, of safely and cautiously but determinedly opening up our community whilst looking after our healthcare system. Our healthcare workers continue to need this support from our community to get through this, and this investment is all about helping those professionals achieve those outcomes. We will be doing everything we can to support them because they are so critical to supporting our community. That's why today we're announcing a $1.4 billion funding package across our healthcare system to help cope with the continuing impact of COVID-19 and in particular the now hopefully stabilising Omicron wave. What this package recognises is that there is pressure right across our system, but not only is there pressure on our system, there is continual 24/7 pressure on our people who are our system. those frontline healthcare paramedics, our nurses, our clinicians, our allied health professionals, our pathology teams, our cleaners, our cooks, our executives. The entire public health system is under pressure day in, day out, like never before. And this $1.4 billion investment is about how the state government can continue to support them and support our wider community. Just in terms of a brief breakup of what that money will achieve and deliver, some $938 million is actually for our public hospitals, so they can continue to meet the increased operational costs that we are seeing in the system. How they can build and sustain that surge workforce that they've built up over the last few years, and how we can continue to support our frontline healthcare professionals like our new graduates here today, and as you will hear from Karen, the great work that our nurses, doctors and other health professionals do every day. There's also investment around the ever-increasing demand for the equipment and the facilities that our professionals need. Currently, we're burning through more than 2 million N95 masks a week in our healthcare system. So we're boosting our personal protective equipment stocks right across the system. And whether that be along also with new therapeutics, new medicines and new equipment that we need to make the treatment of COVID patients a standard part of how our hospitals operate. Karen and Christine were telling me just before that increasingly what we're seeing as people present to hospitals for other reasons, we then detect that they've got COVID-19. So we have to assume, particularly in our major trauma and emergency departments, that everybody is potentially positive. And that means a cautious approach that requires more equipment, more support and more time. We're also seeing, as part of that package, $191 million will go towards that critical PPE equipment. That'll be 40 million N95 masks, 30 million surgical masks, 10 million isolation gowns and 10 million face shields, amongst a range of other PPE equipment and services that are around that. Whether it be the thousands of air scrubbers, humidifiers, the pulse oximeters that we need to support people for monitoring their situation at home or in the community, and the range of other equipment that we are now making standard part of our delivery of important services to look after people at home. We're also investing a further $225 million into our emergency departments to increase support for those departments, as well as getting people where it's clinically safe to do so, the support they need in the community. $200 million will go into expanding the successful COVID Positive Pathways program. That's the program that supports people in their home, but with the clinical access and support they need should their situation deteriorate. As we've seen with Omicron, overwhelmingly, and currently at some 71,000 people, are able to, with support, isolate and recover at home, and therefore keep the pressure off our public health system. That 71,000 makes up about 80% of the total number of people with COVID-19 who can safely manage at home via this program. And whether that means increased remote monitoring, as I've indicated, those new pulse oximetry devices which monitor oxygen levels in their bloodstream and alerts both them and their treating practitioners where that oxygen level deteriorates, whether it's the telehealth engagements, whether it's just the checking up of people through their GPs, their community health partners and other primary health care providers. There will also be a $21 million investment in boosting the on-site surge workforce, which is underway following a very successful trial that started out at Northern Health about how non-COVID emergency presentations can be dealt with through telehealth, through digital arrangements that provide direct access to critical care nurses, emergency department physicians and others, but at the same time links people with those services and with primary care providers in a more timely way that keeps them out of emergency departments. There's also support for the service links when it comes to those links between people seeking treatment at home and their GPs, community health providers and others. There's funding for 8 additional general practice respiratory clinics that we'll be setting up. 5 further primary care urgent centres working closely with our emergency departments to provide that step-down care for fractures, infections and supports that people need. There's expansion funding for non-ambulance transport services to get people home from emergency and hospital presentations safely and securely, whilst making sure our AMBOs and paramedics are able to deliver their priority services to people in greatest needs. There's also $35 million for Ambulance Victoria to bring forward some of their important work, including, as we've seen today, the recruitment of further paramedics. In addition to this very important group behind us, this will bring forward the recruitment of a further 120 paramedics, in addition to this group of 66, all of which build on last year's record number of new paramedics of over 700 people who joined Ambulance Victoria as paramedics in 2021, making it the largest single recruitment year in Ambulance Victoria's history. And I want to congratulate our fine bunch of new paramedics here today. And also, we're here today to make announcements regarding the turning back on of elective surgery now that we are seeing the numbers of cases in hospitals and in the wider community, we suspect sustainably plateau, if not continue to cautiously but gradually reduce. It's clear that Omicron has put a huge pressure on our healthcare system, and that is why both the Code Brown declaration across our public health system and the temporary suspension of non-category 1, non-urgent surgery has been necessary to create that space for professionals like Karen to do the important ongoing work that they need to. Category 1 surgery, trauma surgery, critical surgery has continued on throughout the entire period, and whilst we regret having to delay all non-urgent Category 1 surgery, we are now in a position, particularly in partnership with the private providers, to cautiously and carefully turn that system back on next week. So as of Monday the 7th, as a first step here tonight, we'll change the orders that will allow private hospitals and day procedure centres to recommence day surgery up to 50% of their normal practice levels. That is very much a first step, but a return then to normal elective surgery continues to be our goal, to be achieved as soon as possible and as soon as it can be safely achieved across the entire system. Pending how those hospitalisation and case numbers trend next week, we will then consider resuming further elective surgery as we move into the week beyond, particularly based on the health advice that I will receive next week and beyond. As such, and subject to monitoring what the continued decline that we've seen in the 7-day rolling average of hospitalisation case numbers, we will then be seeking to formalise the arrangements we have with the private hospital system to continue their support of our public health system, which will then allow us to switch back to 75% in the regional areas of our public health system, and potentially up to 50% initially for our metropolitan public health system in coming weeks ahead. This is an approach that we have developed after careful consultation with surgeons, with the colleges of the different surgical groups, with the both not-for-profit and private hospital system CEOs and clinicians, the AMA and the nurses and others who are all at different parts of the front line, who through their outstanding efforts, but more importantly their advice here, believe that we're now in a position to take that first step next week, and then based on further advice that we'll receive, move beyond the 50% in the day surgery private areas of the private health system, to then ramp that up over coming days and weeks ahead. Finally, today we've also released the Q2 data for last year on health performance, and as I've mentioned many occasions, all of our healthcare services are under pressure like never before. What that data shows us is that right across our system, our people are not only working under the most stressful circumstances that they've ever worked under, but they are also dealing with demand that they have never seen before. Whether it's presentations to our emergency departments having increased by 13,000 people year on year in the latest data, whether it's those emergency departments now treating a total of 461,000 patients in the 3 months to December, and you'll hear from the Royal Melbourne as one of our major trauma, if not the major trauma and emergency centre, just what that means for their 24/7 every day of every week demand that is placing on them. Or whether it's here at Ambulance Victoria, where we've seen a 16% jump in demand during that same last quarter of last year, where we now attend more than 91,000 Code 1 call-out cases, making last quarter the busiest quarter in Ambulance Victoria's history. That's why these fantastic new paramedics, the $35 million extra into AV here today as part of this $1.4 billion package, is so important. I might get Tony from AV to speak after Karen, and then we'll hear from Christine, and then we're happy to take questions. So I could ask Karen Foolan, who is a nurse unit manager at a surgical team ward at the Royal Melbourne, to tell us how life is on the front line.
Thank you. My name's Karen Foolan. I'm a nurse unit manager on 7 South West at the Royal Melbourne, which is a trauma and orthopaedic ward. We are currently still really busy. Trauma workload has not stopped during this Code Brown. What Code Brown has given us is a little bit of breathing space to be able to work in these restrictive conditions where we've got numerous staff either isolating because they are COVID positive themselves, or that they have caring needs for children and they're actually unable to attend work because of that. This week alone, I had 3 staff members get phone calls from their schools around COVID positive exposures, either in the classroom or in the school. This situation is going to continue until we stabilise with our children going back to school. My team has been absolutely amazing. They have come up to and stood up and put their hand up to help out every day, but it is extremely exhausting and they are fatigued after doing this for 2 years. We've been working short due to people deciding that Melbourne is no longer where they want to be because they've got family in other states or overseas and they haven't been able to see them. We've had those people resign, and it has been a struggle to recruit. We are recruiting, and we've got some amazing graduate nurses coming on board, but we need highly skilled, experienced nurses as well. My team have come up every day when I've put out the question, can anybody pick up an extra shift? Can you do a double? Can you stay on for an extra couple of hours? I myself have picked up multiple shifts. I've had phone calls at 5 o'clock in the morning. We're short for the morning shift. Can you pick up the in charge, so that we're still working safely, so that these really sick patients are getting the care they need. The nursing teams, allied health, all our support services, our supply teams who have been absolutely amazing throughout this whole pandemic, keeping us well supported. We have never run short of supplies of PPE or anything else because of their work. Please, we are here if you do need help and you are sick, and our colleagues at AV or otherwise bring you into hospital. We will have that ability to care for you, but if you don't need to be in hospital, please use the other services that are available. Use Nurse on Call, use your local GP and other health services. Vaccinations and our boosters are the way that we can get through this. Please sign up and get your next dose as soon as you are able to. The workforce shortages have just been really challenging, but we are getting there with them. The nurses are fatigued. They've had very little leave over the last couple of years. We want them to stay, and the way that we're doing that is we are encouraging them, when our workforce improves, is to take that leave and to rest and recover. It has been the toughest time that any of us have had, and there's nurses who've known no different. There's nurses who came into this profession 2-3 years ago and they've never known anything different, and we need to keep those nurses on. They're our future, and we need to support them and look after them and reassure them that things are going to improve, but that requires absolutely everybody in the community to help. This is ever changing, this situation. The stuff that we have learned from now, from where we were 2 years ago, has changed our response immensely. Like we said, N95s, physical distancing, our air scrubbers have really, really made a difference. In the last 24 hours at the Royal Melbourne, we've had 14 COVID positive presentations to our emergency department. We currently have 54 active cases on our wards. We've got 4 COVID positive patients in the intensive care unit, but we also have 81 COVID positive staff and a further 51 who are unavailable to work due to caring needs, either their exposures or contacts or carers, like I said. We are an adult trauma referral service. We are very, very busy. The Code Brown has meant that we are not doing those Category 2 and 3 elective work, but we are continuing with Category 1. All emergency surgery work, has continued throughout this pandemic. We haven't slowed down much, but we have slowed down just a little to be able to manage with the workforce shortages that we have. We're currently operating 5 COVID wards across the hospital, as well as our ICU. We're reviewing our bed plans constantly and can rapidly increase our capacity to meet COVID positive demand. That's it. Please just make sure you're wearing your masks, performing your hand hygiene, and getting yourself tested and isolating if you have got any symptoms. Thank you.
Good afternoon, everyone, and welcome to Ambulance Victoria. And it's wonderful to be here today with the Minister, with Karen, Christine from the Royal Melbourne, and importantly, a large number of our new graduates who actually start on road here across Victoria from next week. I think if most of us look to where we are today in the community, our lives have largely got back to some level of normality. I know for myself, my children are back at school this week. Their life is returning to some normality, but from the health system's point of view, it has never been as busy. The last 2 years have put unprecedented demand on the health system as a whole, and particularly Ambulance Victoria, and that's been proven out more heavily over the last quarter. Whereas the Minister said before, we've seen 91,000 lights and sirens cases over a 3-month period. That's 13,000 more than we had seen the same time last year, a 16% growth in the demand for our services. So we are under significant pressure, and I have to pay absolute credit to our paramedics, to our first responders, to our surge workforce, our doctors and nurses who have stepped up every single step of the way to ensure we can continue to deliver appropriate and quality care to the Victorian community. If we look at what we've done to be able to address that, and the Minister mentioned before, we had record investment last year of the $759 million provided to the health system. A significant amount of that went to Ambulance Victoria. That's allowed us to bring on over 700 paramedics last year, the largest in our history as an organisation. And I'm very pleased today to see the announcement of an additional $35 million, which comes on top of the $40 million to support our surge workforce, to enable us to fast-track a further 120 paramedics to support our response to the community. Importantly, our paramedics and first responders are impacted the same as everyone else is by COVID, and since October of last year we've had over 1,000 paramedics test positive for COVID-19. There have been some weeks here where we've had more than 10% of our workforce furloughed as a result of COVID-19 or as a result of close contacts. Importantly, we've been able to continue to deliver care to the community as a result of our surge workforce. Over 1,200 members of the community, first responders, student paramedics, members of the Defence Force, lifesavers and others who have been trained up to provide support to our paramedics to enable us to continue to deliver an ambulance service in the significant pandemic that we've all been facing over the last 2 years. One thing I'll say before I'll hand over to Christine, it's important to acknowledge that of all the demand increase we've seen in Ambulance Victoria, 45,000 cases in the last quarter did not require an emergency ambulance. So one in 5, and some days 1 in 4 calls for 000 can be appropriately managed elsewhere in the community. I pay credit to our secondary triage team of paramedics and nurses who are managing more than 1,000 cases a day and referring them to alternative services in the community. But the community can help us. Importantly, there are other services out there. If it's not an emergency, if it's an emergency, we're there for you, as Karen said. But if it's not an emergency, please save 000 for emergencies. Use your GPs. Your GPs are out there, nurse on call, and seek other advice and support if you need it. In an emergency, we're there, but it's important that we collectively work to ensure that our emergency services are there for those who need it in an emergency. I'm happy to take some questions later, but at the moment I'll hand over to Christine, who'll talk about it more broadly from the health system perspective. Thank you.
Thanks, Tony. Chris Kilpatrick's my name, and I'm the Chief Executive at Royal Melbourne Hospital. So I just want to make a few comments about life at the Royal Melbourne Hospital. And if you heard from Karen, we remain very busy, but we are certainly managing on a day-to-day basis to care for the people who need our care. There's no question about that. We have a number of challenges. First of all, trauma continues, and we are one of the 2 adult trauma services here in Melbourne, so trauma continues, and many of those patients require surgical procedures, as Karen has described to you. But in addition, a lot of our surgery is also emergency surgery. So these are people who come through the emergency department and require urgent emergency surgery, such as bowel obstruction or whatever their needs might be. But and on top of that, of course, we have Category 1 elective surgery. And at Royal Melbourne Hospital, of all the people on our elective surgery waiting list, over 50% of those patients are Category 1. And all of those patients are receiving the surgery they need within the time frame of 30 days throughout this pandemic, and will continue to do so. So there's still a lot of elective surgery being undertaken at the Royal Melbourne Hospital. Now, we would like to increase that and do Category 2 and 3, but with time, cautiously with time, that will be introduced. In terms of the investment that Minister Foley mentioned, we obviously welcome the investment to support our staff, to support our organisation, and importantly support our patients through this continuing pandemic. So to hear of the further investment in PPE is wonderful news for our staff. Throughout this pandemic, our staff have always had access to the best PPE and always had adequate supply, but to know that there is further supply is very reassuring. To hear of the investment in the COVID pathway to enable patients to remain cared for out in their homes and not needing to come to a hospital, of course, helps us to manage this, and that's the right care for them. And then, of course, the support for our workforce, which is a challenge, as you've heard from Karen, remains a challenge, but we're doing a lot to support our existing workforce, their well-being, and to encourage others to come and work at the Royal Melbourne Hospital and at other health services across Victoria. So the pandemic remains a challenge as we enter our 3rd year, but we are working with the pandemic, We're learning to live with the pandemic, and although out in the community people might think this is sort of disappearing or it's being much life is much more normal, yes it is, but in the hospital setting it remains a very big focus for us. But I can assure you all patients who need our care continue to receive the care in a timely way. So thank you.
Thanks, Christine, Tony and Karen, and we're happy to take any questions.
So this $1.4 billion package, is that over and above annual operating expenditure and capital expenditure, whatever you would have spent usually on healthcare?
Yes, it is. It's directly demand-driven new funding on all of those areas that I've outlined, all driven by our response to the COVID-19 pandemic.
And will all of this cash flow through to hospitals and services this year?
Yes, that's the intention. If not this financial year, certainly into the system for this year. Whether it's the investment in our paramedics, in our emergency departments, in our COVID positive pathways, partnership with primary care, into the PPE and the range of other areas.
So the Productivity Commission this week released some new data on health systems and found that Victoria receives the lowest amount of funding for its healthcare system compared to any other state. And it found lots of other issues like poor bed availability, staff availability, and slow emergency response times. Do you acknowledge that there's been a history of underfunding the healthcare system that has led to poor outcomes?
I will take issue with you on how you introduced that in regards to the healthcare system. What the Productivity Commission pointed to was a relative per head of population investment in the hospital system. The hospital system is a critical part of it, and this government, more than any other in Victoria's history, has increased funding for infrastructure, people and services, over $8 billion worth of infrastructure, brand new hospitals, Footscray, Frankston, bringing back Mildura into the public sector, Ballarat, Bendigo, Warrnambool, I could go on. But what the investment in the health system that Victoria has undertaken is on par, if not exceeds the national outcomes. Health systems include obviously hospitals, but go well beyond that. Victoria has, I would argue, the best community health service system in the country. We partner with GPs, with primary care providers like no other system. And when you look at the totality of the Victorian healthcare system, I would maintain, whilst of course acknowledging the material that the Productivity Commission released, I would maintain that we have, if not the best, certainly the equal best system in the country when you look at the totality of services.
Yeah.
That is not to say that there is not more that needs to be done. That is why this government, through this $1.4 billion announcement, let alone now 7.5 years of record investment in infrastructure, services and people, we know there is more to be done.
So what the Productivity Commission showed was that Victoria's public hospitals
Yes.
so there's been a history of that.
In a relative per capita system, but as the Grattan Institute has pointed out, there are many reasons for that. The Grattan Institute points to our system being the most efficient system in the country. Geographically, we are clearly smaller than most states, so there are issues of scale and efficiency that then work into that funding model. There are many reasons that sit behind that, but that is not to detract from the Productivity Commission's findings. But if we're painting a total picture, Victoria has an outstanding world-class health system, but I acknowledge that there is more to be done, particularly on the back of this COVID-19 pandemic, which is reshaping how, particularly our public hospital systems, but our whole health services need to be reimagined in a more dynamic way, and today's $1.4 billion new investment reflects that commitment.
Just on the code brown, that was in place, it was going to be in place for 4 to 6 weeks.
Yes.
How much longer does it look likely that this will be in place? Can we get an update on how hospitals
Well, as you heard from Christine, they've never been busier. They're coping, I think is fair to say, but only through the extraordinary effort of their frontline healthcare professionals, their executives, their security staff, their allied health professionals, and the whole ecology of the workforce that has sustained those hospital systems. I think as we see the system of case hospitalisations plateau, we continue to be about 2 weeks behind where our friends in New South Wales have been. The Omicron wave started in New South Wales. It's burst on the systems right across the country except for Western Australia. We continue to be about, it looks like, 14 to 18 days behind the equivalent parts of the peaks in New South Wales. So our Code Brown estimation as to where the whole services are at of about 4 to 6 weeks continues to be the advice I've got. It won't be on for a moment longer than it needs to be, but the advice that I receive every day is that it's an important contributor to making sure that right across our healthcare system we can respond in an appropriate manner.
And do you expect that in opening private hospitals and day procedure centres to some elective surgeries, that's going to direct staff resources away from the public sector into these elective surgeries?
So I want to thank the private providers for their partnership that has been so critical. We've all states and territories have engaged through the National Partnership Agreement with the private sector over the course of the last 2 years. But over the last month, it has been really important to allow us to create the space in the public health system to deal with the kind of pressures that Karen so eloquently described. I would expect now that we've got that, we hope, predictability of where the case numbers in hospitals will be, that allows us, after discussion with those private sector partners and our public hospital services, to now prudently, cautiously turn on an initial 50%, but to take further advice as to what further measures we can take as soon as possible. And I hope to get us to 75% and indeed 100% as soon as possible, right across the system.
Is there a chance, though, that with kids going back to school and people going back
Yes.
to work, that we might see a spike in cases and hospitalisations in February?
Yes, there is, and we've made that clear every step of the way, that the return to school and over 1 million kids moving around the community does not come without risks, but the benefits outweigh the risks. The benefits to families, the benefits to the well-being of those kids, the opportunities it will create for them, the connections and the supports are really important. But we acknowledge, and we've seen from data from the Education Department, that we could expect to see a spike. That is why in cases, that is why the prospect of hospitalisations potentially reflecting that spike in a week or so is a real prospect. That is why these initial steps, we think, are cautious and sustainable, but will allow us, in the circumstances that there are spikes beyond what we expect in hospitalisations, to respond. We don't expect that, but as we've seen throughout the course of the pandemic, you can never predict how this global pandemic will play out.
There is significantly more COVID patients in New South Wales hospitals. I think it's more than triple what we've got right now. Why are they able to operate at 75% and we're going to 50%?
Well, at the moment, they're not operating at 75. They're not operating at any percent, the same as Victoria. They've announced moves next week in their private sector. We've announced moves next week. But as we pointed out, they are in terms of a comparative position on the outbreak wave, they continue to be some 2 weeks further advanced, initially up and now down that curve. So I think at a proportionate position, this announcement we're making today is in fact a significant reflection of our determination to start to deal with those Category 2 and Category 3 wait lists in a way that is prudent, a way that has support of both the public and the private system and can start to deal with some of the real issues that we're all too familiar with as we regrettably had to pause Category 2 and Category 3 surgery.
Are you being too cautious with the resumption of elective surgery?
No, I don't believe so. It's based on health advice. It's based on the conversations with the frontline professionals in both the public and the private system, which is regularly, when it comes to the surgeons community, the same people. And we believe it is a prudent, measured way that we expect to build on based on the advice that I will get once we see how the system plays out starting Monday next week.
Once we get below 600 cases and those changes come into effect, is there another trigger point, or is the next point back to full capacity?
That's one of the triggers is hospitalisation numbers, and my reference to the rolling average, weekly average, is a high level trigger point. But what we want to make sure is that essentially the services that the public sector needs to deliver the support for the COVID situation that particularly Karen outlined, that once we can lock in that support from the private sector, ICU access, theatre access, support for particular services, we want to then get the private sector back to whether it's day surgery or multi-day surgery and elective surgery beyond 50%. If we can secure what it is that we need to keep COVID patients safe wherever they are in the combined public and private system, we would turn back on the private system to full capacity as soon as we possibly can. And if that's the week after the next or the week after, we will see that build. That will also then be an opportunity to discuss again between the public and the private sector what we can then do to redouble our efforts to address those unfortunate but sadly necessary increases in the waiting list that we've seen in Category 2 and Category 3 surgery.
What is virtual triage like? Is it like an alternative to triple O, or how do you use it?
So this was trialled in Northern Health during the winter of 2020, and it was exceedingly successful, particularly for those people who showed some trepidation during outbreaks of approaching emergency departments. What it does, it either digitally or through a telehealth method gives you direct access to a clinician, whether it be a trauma nurse like Karen and her colleagues in the emergency department, or physicians in the emergency department. They are available there at Northern Health to advise you on non-COVID related matters about what is best for you. If you need one-on-one clinical support and you need to be transported from home to a hospital, then of course that is available. But if you don't, and you nonetheless can be safely and clinically appropriately dealt with through that mechanism, or indeed put in contact with a community health provider, a GP or another primary care support, then the partnerships that those emergency departments build up in their local community with those providers has provided an efficient, safe and timely alternative to presentations at emergency department, whilst making sure you get that emergency department level care. It's been really successful, and not that we want to thank the COVID-19 pandemic for much, but it has shown opportunities like this as real safe alternatives to physically presenting at emergency departments.
On the COVID deaths, how many of those 36 were actually from yesterday?
Well, from the last 2 days, in fact, is the sort of measure we take. I think it was 10. Some 18 had occurred over the previous fortnight, and 8 had occurred some far back as November, one case in December, and the remaining 6 from earlier in January. And that's as a result of, as Christine indicated, whether it's material on death certificates and other arrangements, we're increasingly seeing, as case numbers increase across the community, we're seeing death certificates and other reconciliations of people who have tragically passed away with COVID coming into the system when perhaps there are other contributing causes to their sad deaths.
Minister, what planning is the government or health officials doing for the possible emergence of another variant? I assume this money is being put in place just to deal with Omicron. Is there any substantial planning or funding allocation to?
So your assumption, perhaps whilst well-founded, is not fully correct. This is about preparing our, yes, it's driven by Omicron in the here and now, it's driven by what we expect to be the ongoing management of the COVID-19 pandemic for some time yet. Yesterday you would have seen the Chief Medical Officer of the Commonwealth at the Senate's inquiry into the COVID-19 pandemic talk about how AHPPC and the cooperation across the states is really working on the basis that this global pandemic, whilst playing out differently, very differently in 2022, still has some way to go. We don't know if the next variant will be less virulent or more virulent. We're hopeful that that is certainly the case. We are hopeful that the worst days of the pandemic are behind us, but we have to prepare for, as the Chief Medical Officer pointed out yesterday, and as AHPPC through all the states discusses and prepares every day for, what are we expecting next? Whether it be the BA 2.0 or 1.2 variant, or whether it will be another variant altogether. What does the kind of emergency departments and Ambulance Victoria services and surgical wards that Karen, Tony and Christine have to deliver, what do they look like as they prepare for living and delivering services alongside of COVID as part of our community? That sort of work is well and truly underway, whether it's in partnership. We're blessed here in Victoria with some fantastic medical research organisations, the Burnett's and the Doherty Institute being world leaders in this area. We're working with universities, and more importantly perhaps, we're working with our health services and others in predicting, as far as we can in this unpredictable world of a pandemic, what is likely to come next, and trying to get our systems in place to deal with that.
What are you expecting to revise the recommendation about working from home?
So of course there are no pandemic orders in place that restrict attendance at work. It's a recommendation, and what we've seen is Victorians vote with their feet, really, and employers work with their staff in a sustainable way to make sure that what they do is safe. We've seen now 2 years into this global pandemic a level of sophistication and approach from employers and employees to work through what they are comfortable and safe with. So there are no pandemic orders in place restricting participation at work. What there is that recommendation. What we've indicated is that as we get into February and beyond, that we'll have more to say about that, but there's nothing to stop workers and their employers coming together in a sensible way, as they've been showing, as mobility starts to cautiously increase again, to come back to work, provided that the well-tread path of COVID-safe plans for workplaces are in place.
Is it a double standard if theatres and major events can go on, but work at the moment still happen from home, or should happen from home?
No, because those theatres and workplaces are following their COVID-safe plans, and workplaces are following their COVID-safe plans.
Would you like to see full crowds or a full stadium at the MCG for the AFL season, men's season when it starts?
Of course, I think we're all expecting St Kilda to now come along and make up for the club with the longest premiership drought to be rectified in 2022, and that will require strong support for all us Sainters out there. But what we've seen in our public events framework is any event that attracts more than 30,000 people just needs a COVID-safe plan, and subject to the conditions of what that COVID-safe plan is, they can go ahead. We saw that at the Boxing Day test. We've seen it at the tennis, and I look forward to the AFL going through their processes for their venues, and I'm sure they will.
Do you expect it to be 100%?
Well, it can be. It depends what they come forward with their COVID safe plan. It might not be. Let's wait and see what they submit. But I'm looking forward to, subject to wherever we are on the global pandemic at that particular time, the AFL, who have been fantastic over these last 2 years of making sure that they can deliver their seasons, but this time with their fans and supporters in those stadiums.
Have they submitted a COVID safe plan for that opening round?
Not to my knowledge, no, but they've got plenty of time. But of course, they are in regular contact, as indeed all sporting codes are, with our public events team.
It looks like the MCC is really confident that we'll be able to have, packed stadiums. So, are they right to be confident? Do you think? And is it something we should be confident about?
Well, based on their Boxing Day test achievements, where they delivered a fantastic event over not 5 days but 3 days in the end, I think they have every right to be confident. But of course, it all depends on the circumstances at the time. They know that. The last thing sporting codes want to do is to be part of any transmission event. They know that with high levels of transmission in the community, that it's their role to support only those people who come forward who are vaccinated, but to do that in a safe way. And we saw that at the tennis, we saw that at the cricket, and I'm continue to be hopeful under current circumstances and trends that will be the case for the AFL season.
Where are, last question, state-run aged care facilities, where are they at with getting all the residents triple vaxxed?
Well, we achieved the visitations to all of the states, state-run residential aged care services before Christmas. That I don't have the exact number on me. I'm sure we can get it to you as to what that meant in terms of actual numbers of both staff and residents who were vaccinated. But there is, as a result of that, there's continual changeover as both new workers come in and new residents come in, that important work needs updating. But the last I saw was that, but this was pre-Christmas, was that every single state-run site had been ticked off in that regard.
Do you have an update on how many students and teachers have tested positive during week 1 and back to school?
I don't have the full week because it's not yet completed. The Education Department released some data yesterday which had about 1,000 kids and about 79 staff had returned positive in the immediate reporting period. And I think that shows that the system's working. With more than 1.1 million children now back at school, to have that level of rapid antigen tests being undertaken twice a week in every state, independent and Catholic school setting, and more than that when it comes to special schools, to have that level of reporting shows that the system's working. That's a lot of people, clearly, but we need to sustain that effort at least over the first 4 weeks of term and potentially beyond. Anything for our friends here? Last questions? All good? Thanks, everyone. Thanks, Drew.
I am.